Today we're here at Tri-Cities Skin and Cancer, their Johnson City location, and I'm joined by Dr. Bianca Stashak and Pam Duff. Thank you all so much for taking some time. I know, Doctor, you're really busy, but we're talking about something very important here today. It's the Mohs Micrographic surgery technique. Tell us about Mohs.
Well, Mohs Micrographic surgery is a procedure that allows skin sparing while eradicating skin cancer. So the most common skin cancers that we treat are squamous cell carcinoma and basal cell carcinoma.
Right.
These are skin cancers. Squamous cell carcinoma can occur in other areas, but we are talking about skin squamous cell carcinoma. The procedure involves removing a margin of tissue, usually the biopsy site and whatever looks like skin cancer, and processing that tissue by frozen technique. So the tissue is actually frozen and then it's placed on slides. And the surgeon themselves is the one who does the interpretation. So they are able to map out exactly where they do see persistent skin cancer and whether or not they do. And they can go back to that exact area to take more tissue if they need to.
Because sometimes, you know, in common terms, the cancer may have roots down into the skin, and so taking it a layer at a time and examining it, that way you make sure you get everything.
Exactly. It can be deeper and it can be broader or both.
And so, Pam, you've actually had this procedure done.
I did.
Talk to us about your experience with Mohs.
At first, you're kind of intimidated when you first go in, and the way that the procedure starts, and then you start feeling more and more comfortable. And it didn't take very long. They got it what they call the first pass.
Right.
Sometimes they have to take more tissue, and they'll have to take it 3 or 4. Is that correct, or more sometimes?
It can be, yeah.
So I was lucky enough to have it done with the first pass.
Very good. And talk to us about the recovery time the recovery situation that you went through.
Well, the first 48 hours I thought was the most difficult because you couldn't bend over, and there were certain limitations that you were instructed to do. But after that, I had my sutures removed and been fine and perfect ever since.
Great success story there with Pam. But that's what the Mohs is all about, is those success stories, the success rate. Talk to us about the success rate of Mohs.
So the success rate is about 98 to 99% cure rate. So 1 to 2% risk of a recurrence. Now, when you have a tumor that has been recurrent from prior surgeries, it might be something that has a lower cure rate in general, but by and large, Mohs Micrographic surgery still has the highest cure rate for skin cancer treatment.
And let's talk about the difference. You were comparing it to regular skin cancer surgery. That taking that bit and going to the lab and checking on, that's the big difference here, isn't it?
It is. If you think about the way that tissue is processed when it is biopsied, you'll do a standard bread loafing through the tissue, and you will see about 0.1% of the entire margin of that. So if you consider that compared to 100% of margin assessment in Mohs Micrographic surgery, it's quite a difference. And so it really gives you that confidence when you're going under that reconstruction that it is gone.
And who's the patient? Who do you recommend this for if they have a skin cancer, they've been diagnosed, or they could come see you and be diagnosed? Who's a prime candidate for Mohs?
Well, generally, Mohs Micrographic surgery is used on the head and neck, hands, feet, and genitalia.
Okay.
These are areas where we want to spare as much normal tissue as possible, areas where you cannot simply always pull the skin side to side. Okay. Anyone who has skin cancer on the head and neck or those other areas would be a reasonable candidate for consideration. And sometimes the reconstruction will be performed in conjunction with other providers as well. Sometimes ENT physicians as well, and plastic surgeons.
And with Pam, though, I mean, you had yours done on your forehead, and it's blended in well. You can't hardly notice anything at all. All right, success rate, taking care of skin cancer. That's what the bottom line is here.
It is. That's the bottom line. We enjoy the reconstruction as well, which is something that we do quite a bit of. But absolutely, that cure rate.
Love seeing those cure rates. Love seeing that success. Pam, Dr. Stashak, thank you so much for taking some time with us today. Folks, it is Mohs Micrographic surgery. You can have it done right here at Tri-Cities Skin and Cancer in Johnson City.